Well, welcome back to Your Health television program. I'm Dr. Lisa Hernandez. I'm your host today for the program. We've been speaking about teen pregnancy prevention, and as this is Teen Pregnancy Prevention Month, I've convinced Rose Colon to stick around for the next segment, who is going to talk to me about prevention efforts for teen pregnancy available here in Monterey County. Preventing teen pregnancy is a priority because of the economic and social cost on teen parents, their families, and the community. Prevention efforts work by teaching teens why it's important and how to delay sex and the steps they need to take if they become sexually active. Again, Rose, thank you for taking the time today.
Great.
And last segment, we talked a lot about the data and the social impact of teen pregnancy. We started to talk a little bit about prevention efforts, but if you could talk specifically about the programs that you oversee as the maternal child adolescent health coordinator for the county.
Some things that we think are really working and that we're excited about is something called a clinical linkage. Our peer educator program provide a postpone card to our students after a presentation, and during the presentation they get one of these after, and what it does is it entitles them to go to one of our county clinics. And our county clinics, once they get there, they will give them or provide them with a $10 Target incentive card, and they can go there for a sports physical, to ask about birth control, to ask about sexually transmitted diseases, any question at all. It's our way of getting them to a clinic early to start asking those questions that they need to ask about their body and their own personal situations. And we want to break that barrier, that myth about kids not wanting to go in a clinic. Mm-hmm. And so this has been very successful for us. By providing these postpone cards, kids get a chance to go in there and take a look for themselves. And they also might sometimes get a real look at a doctor, because we know also culturally that mom and dad don't take our teen girls to clinics. Don't think they need them because they're not going to have any sex, so they don't need to go.
Well, this is a great card. It seems like it's a win-win.
Yes, absolutely.
The teen wins because he or she gets a gift card to a popular store, and they also get information and care.
And most important, the right information.
Yeah, absolutely. That's very true. One of the things that we may not have time to talk about is the messages out there from websites and other venues that are not reliable. So this is nice to have. What other programs besides
We also teach parent and child communication. We teach parents how to be askable parents, which means we want mom and dad to be the go-to person. We don't want kids learning about sex in the streets. We want them to get the right facts. We want mom and dad to have that crucial conversation about, tough stuff, about birth control, about staying a teen. And again, we talked about postponing sexual activity, but also about, expectations and family values, things that kids really need in making these critical decisions when mom and dad aren't around. So when mom and dad feel comfortable with the message about talking to their teen about delaying sexual activity or teen pregnancy, the more comfortable they feel, the more apt they're going to be to open up that communication, start having that real tough conversation about, what are you going to do if you get pressured to having sex? What are you going to do if you're somewhere and maybe you're under the influence of alcohol, drugs, and somebody wants to go hang out somewhere and be alone? What are you going to do about that? So those are the conversations we want parents to have, and that's kind of the stuff we teach them. And at the end of the training, they get an evaluation, and the evaluation is overwhelming. Parents say, "Oh, this is key. No one ever told me about this subject, and I'm going to change this. Things are going to be different in my house." So it's been very successful.
Wow. And is that program, the Askable Parent, offered in English and in Spanish?
Absolutely. Probably we provide that presentation to more Spanish-speaking parents than any other.
That's great. That's great. I want to be able to give you the opportunity to talk about a specific program that's starting up in the next few months through the Monterey County Health Department. And I have to look at the name because I always call it by its shortened acronym. It's a California Personal Responsibility Education Program, or CalPrep grant that we just received. Can you talk a little bit about that?
Yes, we're
program?
very excited. The top 10 communities who had the highest teen birth rate were the only communities invited to participate in the grant selection, and of course we ranked number 6. The exciting part is that we get to bring an evidence-based curriculum to Monterey County that we've never tried before, and I'm always willing to look at new things that we can do to prevent teen pregnancy prevention. The Cuida de curriculum, which is going to be implemented in the fall, is going to teach kids in 6 sessions, how to be, have self-respect, take personal responsibility for your body, make good decisions, how to give girls strength to say no, how to not succumb to peer pressure. It's all about life skills. It's all about also providing skills for adult preparation. And so we're really excited about that.
So cuídate, I know some Spanish, but what does that mean in English?
It means take care of yourself.
Oh, that's excellent. What a great theme. And who is eligible for the program? Is it just girls only, or is it?
No, that's a great thing about it. Sometimes we target traditionally all males or all females. It's for both male and female teens. It's from the ages of 13 to 18.
Oh.
We're going to have a chance to provide this all over Salinas. This will be our first pilot. We'll be able to access some students at the Boys and Girls Club. We'll do incarcerated youth. We'll do Rancho Cielo teens. We'll be able to work with teens, youth in transition, youth in foster care homes. So we're really excited about this.
You're going to be really busy.
Yes, very fast.
And if I remember, this grant also, besides the topics that you mentioned, also will give messaging on HIV and STD prevention as well.
That is one of the biggest chunk that we've never been able to do before.
Yeah.
We've always touched on a little bit during reproductive health, a little bit HIV/AIDS, but this really wants you to really talk about HIV/AIDS and how to prevent it, and really talks about not just talking about condoms, but we've got to do full demonstrations on how to put on a condom.
Yeah.
So it's very different, very fact-based, very to the point.
Well, thank you. We've talked a little bit about Askable Parent. We talked about the postponed cards, which I think are really important. And then we've also talked about the Cal Prep grant. What other programs does the county offer, the health department offer, and maybe if we have time, some of the other programs that might be available for teens who are interested in getting the correct messages?
Right. One of them, the very exciting thing, is our peer educator program. The postponed peer educator program is currently at Everett Alvarez High School and Alisal High School in Salinas. It will soon expand to Salinas High in the fall. It's very exciting. It's been going on for many, many years, almost 10 years, and it features at least 40 kids from each of the schools who are interviewed by their peers. We keep them usually for 4 years. They're trained. Mm-hmm. They get 2 full days of reproductive health and healthy relationship training. So they talk about a whole spectrum of issues: domestic violence and STDs, reproductive health, how to safely surrender a baby so babies aren't put in trash cans, but they're surrendered, and what the law requires for taking them to hospitals and fire stations without getting in any trouble at all. So we really teach them all the facts. Everything's fact-based and peer-led. They would rather get this message from their own peers than anyone else. But what's most important is that we're building in those 40 peers is leadership skills. They now have the facts, and they become the go-to people on campus. So if I'm listening to the presentation and I'm a student, and I know that Dr. Hernandez is giving the presentation or Lisa's giving the presentation, but I have a question that's kind of private, I might see you in gym and say, "Hey, Lisa, I heard your presentation. Tell me about this." So we also keep a log on how many times they were spoken to one-on-one privately about some of the reproductive health subjects. So it's very popular, very exciting, and we're very pleased with the program. The evaluation results are overwhelmingly a success.
And the peer educators can be girls or boys?
We have both, girls and boys. Can you imagine a message like that by boys? Wonderful.
Yeah,
we're very lucky.
That's great. And do they also use the postponed cards as well?
Yes, in fact, after every presentations, and they wrote the slides, the scripts, most of the scripts. They have an evidence-based curriculum that they do adhere to, but things that are true life scenarios, they write themselves. And what's very exciting about that is they also, after each presentation, get to talk about the clinical linkages, mm-hmm. and get to talk about going into the clinic for the very first visit. And everyone gets one of the cards. They reached about 2,000 students last year.
Wow. Mm-hmm. Very amazing. And what other programs are coming out of or coalitions that are coming out of the health department that
we have Awesome. I'm just, I can't even stop. We have an
We're so
awesome
excited.
coalition. We have the Collaborative for Salinas Youth, which I can't take credit for, inherited in this position. It is wonderful. It is a group of youth-serving agencies who really, the goal is to really to work on youth development, because we know that youth development and really hiding youth as leaders is really the answer to preventing teen pregnancy prevention, and also the answer to preventing drug and alcohol abuse by making kids feel important, giving them some leadership skills and some leadership opportunities. We know this could be done. So we work and have a bi-monthly meeting, and we talk about everything about how to continue to sustain working programs. Sometimes we collaborate on grant opportunities, but most importantly, we listen to what the youth say that they need help with, and we really let them drive the bus on where we're going.
Oh, excellent. So I've heard about peer educators, the Cal Prep grant, Askable Parents, this coalition. Those are really good resources, and I hope there's some teens or some family members of teens that are hearing this. But tell me, if we've got a teen here that's listening, can you give some advice? What can teens do to help postpone early sexual behaviors and teen pregnancy?
I think one of the most important things is knowing the consequences of sexual activity, knowing what's the possible outcomes, and not just birth control alone, but also knowing what happens when there's no condom use and STDs. And also, telling them about, you're only a teen one time. Stay a teen as long as you can. Enjoy your own childhood. Just because you're a teen doesn't mean you're adult yet. Enjoy it as long as you can. Take care of one person, which is yourself. Take care of yourself, your mind, your body, and then worry about everything else later. But get the right facts, get the information, do your homework, and remember that your body and the choices you make can only be your decision and your decision alone. Don't succumb to peer pressure.
Mm-hmm. And one thing that I'll just put a plug in that sometimes we forget, we talk about abstinence and not having sex at all. That is truly the most critical thing to do. But if you have been sexually active, just because you've been sexually active doesn't mean that that's it, this current state of being. You can stop. You can choose to stop being sexually active when you're with that current partner of yours or for the next partner. So that's another message that I always forget to point to always to make. But
absolutely, absolutely. And also, choose friends that have the same core values that you do.
Mm-hmm.
If your core value is to abstain from sex until you're an adult, then choose the same crowd that's got the same core values as you do. That makes it easier.
Yes. So switching the gears now from teens to parents. What are some of the things parents can do to help their adolescents or and teens delay initiation of sexual activity or teen pregnancy?
Get over your fear, your own fear of opening up that dialogue. Have that honest conversation with your child. It's the best thing that you can do. I mean, pick a day that you're not walking into your child's room and sitting on the bed and making it obvious. Be on a long drive somewhere and say, hey, I know there's a lot of peer pressure out there. I know a lot of things are happening. And this could be happening, and have that honest conversation about what the consequences, what that looks like, what that could end up being. But have that conversation and open up that dialogue, because again, that leads to conversations about other tough subjects. So that's the best thing. But also, parents don't have all the facts as well. Mm-hmm. And in doing our parent-child communication classes, we found out that there are some moms that didn't know a lot about anatomy, didn't know a lot about their own body parts. And so, providing the facts and getting the tools they need to have that conversation is also key. And we can make that happen for them.
So you're doing that during your Askable Parents.
Absolutely.
You're teaching the teachers that are going to teach
them about anatomy. We're teaching them exactly what happens. Yeah, and some didn't even realize. Oh, I didn't even know that. And these are moms 3 and 4 times over, so it's very interesting. Mm-hmm.
Well, excellent, excellent. You talked about some of the resources that you use in the classes. Are there good resources in the community, on the web, that you would point to as good places for teens or parents to use to get the correct information?
I think that one of the ones that we look at and that we work with very closely is the National Campaign to Prevent Teen Pregnancy. It's a very good website for parents and providers and people, anyone working with youth. And then the Stay Teen that I talk about, stayteen.org, is really good for teens. That's for teens. Teen Talk through Planned Parenthood is also a good website. There's also Girlology, which is girl empowerment, and that's for moms.
Say that again.
Girlology. www.girlology.com.
Okay.
And Girlology is a good place because it really talks about girl power and girl empowerment, and it goes back to the core values and taking care of yourself and your body. So it's very exciting. A lot of stuff out on the web, a lot of good facts.
So repeat those again. There's the National
National Campaign to Prevent Teen Pregnancy.
Okay.
And then there's Girlology.
Girlology.
And then there's Stay Teen for teens.
And there was one more.
And then there's
Planned Parenthood one?
Yeah, Planned Parenthood is Teen Talk.
Teen Talk, okay. So those are web-based.
Right.
A provider would be another
Right,
good resource.
absolutely. A provider or a clinic, or reaching out if you've got a program on if you go to Everett or Alisal or one of the others, and get involved with other teen empowerment groups. There's many out there.
Okay. I'll make a plug for another resource.
I know what you're going to say.
Our website?
Yeah.
There's the community. There's our website, which has a lot of the resources on there about the programs that we talked about, and also has information about sexually transmitted diseases that we mentioned a little bit now.
It's
HIV.
got the teen birth rate report.
Has the teen birth report, or the birth report that has the teen birth rate information in there. So there's lots of resources available. That I think are worth mentioning over and over again, just so that we remember the programs that we offer at the health department are the Askable Parent.
Right.
And how do parents get involved with that? How would you find about that?
Usually, well, they can ask whatever school they're at, because we go to PTOs, PTAs.
PTO, what does that mean?
Those are the Parent-Teacher Association, organizations. The PTAs are the same. And then there's Migrant Ed does a really good job. We go into Migrant Ed classes where parents are. And we're usually invited in to where groups of parents. So we already get invited to groups that are already existing.
I see.
Very rarely do we conduct one in different communities unless we're invited, and we get invited all the time.
So if you're an interested parent, the best thing to do is
go to
the school and get that information.
Right.
And the peer educator programs are specifically at the 3 schools.
Right.
Okay. And then the Cal Prep grant will be coming out soon.
Yes.
Hopefully, we'll see more of the activities in July.
Absolutely.
Well, that is excellent, Rose. Any any quick comments that you want to make in terms of advice to teens or parents when they're thinking about sexually transmitted disease, HIV, or sexual activity?
Postpone it as long as you can. Postpone it as long as you can. And if you're going to have sex, use protection. And birth control alone doesn't keep you from getting STDs. Condoms do.
Okay. Well, thank you very much, Rose. I think we have one more minute. I wanted to just explore one thing that we talked about briefly about one of the challenges in some of the communities where we see a younger female with an older adult. And that's something also I think would be good advice for parents to make sure they know who their daughters and sons are socializing with.
Right. While we have a high teen birth rate for females, we don't have a high teen father rate. So our teens aren't getting our teen girls pregnant. Male adults are getting our teens pregnant. And you're absolutely right when you talk about know who your child's with, because the fastest way to succumb to peer pressure is through these adult males, and that's who's getting them pregnant. And girls are understanding what the consequences of that, and they're not placing them any longer on birth certificates. They're omitting father's name, so the law isn't involved, and there's no child support to collect because they're not putting the name down because they know that there's a problem now with that, and there can be charges that are levied with that. But it's not our teen boys that we're having the problems with. It's the males who are preying on our younger teens.
Okay, well, thank you, Rose. One other last plug is for this postpone card. One of the things that I don't know if Rose mentioned is that these clinics also offer what's called a family pact, which is a service for teens, young adults, to get free care, confidential care for services, whether it's a physical, birth control, testing. So that's another piece of information that is important. If you don't get a card, look up Family Pack, because that's another program that we still
And it's
offer.
not just for teens. The Family Pack goes all the way up to the ages of 25.
25. I almost said 24, so good. Okay,
Yeah.
25. So another great service.
Right.
Well, thank you, Rose, for being a guest and toughing it out for 2 segments. As usual, your information is great and informative. I'll let you get back to work. Thank you, Rose, for your time. We're going to take a short break. I am Dr. Lisa Hernandez, and this is your health television program, and we're talking about teen pregnancy. Don't go away. We'll be back in a few minutes.